So a lot of people are asking what's the overall goal of hormone replacement therapy or what it does. So there's a lot of data coming out showing that hormone replacement therapy in both men and women is really important for managing and preventing a lot of the diseases, the foremost chronic diseases in America. They are atherosclerotic cardiovascular disease, cancer, neurodegenerative diseases, and metabolic dysfunction. So let's talk a little bit about how hormone replacement therapy can help each one. So as far as atherosclerotic cardiovascular disease, estrogen therapy, especially in women, is particularly important in postmenopausal women. Declining estrogen levels are linked to an increased risk of cardiovascular disease. This is why women, once they start going through menopause, they have one of the highest risk of heart attacks of all people in America. Now, estrogen really has a protective effect. It influences your lipid profile by lowering the quote unquote bad cholesterol and increasing good cholesterol or HDL, and as well as, which we'll talk about in another video, the important things such as ApoB, LP little a, LP big A, and that ratio that really does show improved cardiovascular protection. Some studies suggest that if you initiate it close to menopause, it can help reduce the risk of this. So it really is recommended to get a personalized protocol. As far as testosterone therapy in both men and women, low testosterone levels have been linked to an increased risk of cardiovascular events. Testosterone therapy, when managed appropriately, can really help maintain muscle mass, reduce visceral fat, and improve your lipid profile, which obviously impacts your heart health. As far as cancer, this is something that you have to really have careful consideration. The relationship between HRT and cancer risk is complex. There are studies that came out way back in the early 2000s that scared a lot of patients and clinicians about estrogen and progesterone, possibly increasing the risk of certain cancers such as breast cancer. But there is studies showing that that study was not done appropriately. They were testing people with synthetic hormones instead of bioidentical. And really, when you look at the data, hormone replacement therapy actually decreases a lot of risk of other cancers. So this is why you need to go to a place that has your best interest in heart and really discuss the risks with you. This hormone replacement therapy is highly individualized. Now, the benefit of hormone replacement therapy is that a lot of our patients, they become a lot more proactive with their health. But it is required, especially in men and women, really have to have appropriate screening done. In women, this means mammograms at the recommendations by all the major organizations, as well as public exams. In men, although there's really no link to prostate cancer anymore, it really is appropriate that we check your PSA and monitor it regularly if you're at an age where it shows you're at increased risk. As far as neurodegenerative diseases, so estrogen in both men and women has been shown to have a cognitive protection. So it really does help lower the risk of Alzheimer's disease and other cognitive disorders. So really, when it comes to women, some studies show that if you start HRT during the early postmenopausal period, it really supports brain health and reduces the risk of neurodegeneration. Whether you're a man or a woman, hormones influence your mood, sleep, and overall mental well-being. When you're on a properly managed hormone replacement therapy program, medication actually helps alleviate symptoms of your anxiety, depression, and sleep disturbance, all of which are obviously linked to better overall health in the long term as far as your brain. The real kicker here that's important and most Americans are walking around not knowing is that your metabolic dysfunction and as far as type 2 diabetes. So insulin sensitivity, a lot of people are insulin resistant or very close to being insulin resistant. And hormones like your estrogen and testosterone, they play a critical role in improving insulin sensitivity. So when a man or woman has declining estrogen and when a man or woman's testosterone is low, it can lead to increased insulin resistance, which will eventually lead to type 2 diabetes if not corrected. So HRT improves your insulin resistance, which helps manage your weight. It also decreases your body fat and helps with body fat distribution and glucose control. This really does help improve your overall metabolic health. As far as weight management, proper hormone balance aids in controlling your appetite. It improves muscle mass and reduces abdominal fat, all of which are crucial for managing your metabolic health. There are studies showing that proper testosterone replacement therapy in men and women actually will decrease the visceral fat, which is the bad fat, which leads to things like fatty liver disease and other metabolic dysfunction. So no matter where you go, whether it's our clinic or another clinic similar to ours, it really is important that you discuss the benefits and risk with your provider. And as far as if you're a woman, proper timing or initiation of hormone replacement therapy is key if you're going to be on estrogen replacement therapy. I would like to say that we have men and women of all ages on hormone replacement therapy, people in their late 20s, early 30s that have clinical symptoms of non-optimal hormones, men and women, and then people all the way up until their 80s. They are thriving, but it's really important that you go to a place that has your best interest in heart and is not just trying to sell you something, but is actually trying to help manage your overall health and improve your well-being. The goal is not just to improve your lifespan, but health span, meaning why live till 100 and be miserable when you can live till 95, 100, but actually be thriving. You don't have pain, way more improved energy, improved mental health, and improve overall well-being. Look better, feel better, and perform better. Get started with us today.